Hello, how are you, Ali?
Oh, thanks for joining us.
You're welcome. You're welcome for having me here.
Yeah. So, it's 5:30. I like to
Yeah,
start on time. We have a bad reputation as providers that we don't start on time, so
we are on time.
we're on time. Okay, so
I usually run late in the hospital, but not here. This is easy.
I wasn't gonna say that. It's fine to say. So with us today is Dr. Arsala Bakhtyar. She's a graduate of Dow Medical School in Pakistan. She completed her pediatric residency in Ohio University and completed her infectious disease fellowship at the University of Michigan. Go Blue always. So,
Always.
recent reports of a new life-threatening pediatric inflammatory syndrome like virus has been causing a lot of fear amongst parents, providers. I know I've been receiving a lot of messages here on Instagram of people asking how real is this. So I thought I'd like to provide this platform to share a discussion with you on this topic since you are the expert board certified in infectious disease and pediatrics. So thank you for joining us.
You're welcome.
So if you could just start off by maybe giving, for those of us that don't know too much about this, just giving us a short introduction about what this is.
Yeah, this scare started out in Europe actually in late March when they noticed that, falling about a month behind from COVID-19 outbreak that happened, some of the children started presenting to the hospital with this kind of like a multi-system inflammatory syndrome where they had a high fever for a very long time. Then they had some symptoms that were similar to a disease which is called Kawasaki's disease, which is also an immune-mediated disease. And the features that these children would have would be, very similar to Kawasaki's, where they had a prolonged fever for more than 4 days. They would have conjunctivitis, which is pink eye. They would have some GI symptoms with diarrhea, abdominal pain. And they started noticing this outbreak of this Kawasaki's like illness, and they all got concerned. So until they could get a hang of it, now they have gotten a hang of it and they know now like what's happening. But at that point, it was a scare. While their studies were going on there, they did collaborate with the United States, and probably by that time in the New York, they started seeing these as well, month into that COVID illness. And then very recently, we had the scare in Michigan where we had a surge of cases at Children's Hospital where children came in with all on one day, like 10, 15 kids, similar kind of illness. And now, since they have a hang of it, now they have a case definition that anybody who is under the age of 21 years presenting with fever of more than 4 days, the biggest symptom that these children will have with GI would be GI symptoms, which include abdominal pain, diarrhea, vomiting. They can have rash, or any of these, rash, cough, headache, and then the laboratory findings, which is a slew of laboratory findings that we can go over. But the symptoms that the parents would notice is that the child would spike a high fever, and that would last for more than 4 days. And then you would have GI symptoms along with that, and then the rash, the pink eye, cough, headaches.
Okay. So when you say high fever, can you explain what you mean by high fever? Is it something like 98 degrees, 99?
Anything more than 38 degrees centigrades, which, how do you convert that? I think
I
100.
usually we say 100.4.
Yeah. So anything over 100 and 100.4 and above would be considered a high fever. So most commonly when children have a normal viral illness, they will have fevers and they would go on for maybe 2 days, 3 days, and then they go away. If you have consistent high fevers for more than 4 days, you always want to make sure that you're not missing out on anything else.
I read one report from New York that said, I'm not sure how accurate this is, that all the cases had a fever of 101 actually. So like you said, higher grade fever. So not just a fever, this is a high temperature.
Mm-hmm. More than 38 degrees centigrade, yes.
And how common is this now?
So it can be common because this virus has been gentle to children, right? So the propensity of infection, so the vulnerability of the children to get infected from this virus is already low. They're not getting infected that much. So in the entire month of March to April end in UK, we had 35 cases. In New York, which was on itself is a whole big country size, about 33 cases. In Michigan, we had like 10. So it's not like every kid is getting it, because kids are not getting the virus that much, so they're not getting this as much.
So do you feel that some of the scare that was going on was part of the unknown, or the fear
The
that...
scare is real. The scare is real because if it happens, it's a very dangerous thing to happen, but it is not a common thing to happen. That's what I mean.
And I know you touched upon some of the symptoms. Have you been seeing, based on some of my readings of like swollen hands and feet, are you seeing that as well, or is that not common?
This can occur because it's a vasculitis, so it can occur. It can occur. The same strawberry tongue, same mucosal involvement like Kawasaki's disease. I mean, it is in itself a distinct illness. It's not exactly like Kawasaki's. It is an illness that is an immune-mediated illness that could be very similar to Kawasaki's, or, staphylococcal or streptococcal toxic shock syndrome. Any of those symptomatology can be present in this. But this disease, if you compare it with Kawasaki's disease, and if you go one by one about each marker or symptom, it will be a distinct disease in itself. But yes, you can see the hands and feet swollen.
So when you say this is an immune-mediated disease,
Mm-hmm.
can you touch upon that a little more for some of us?
So if you look, I don't know how much of it you have looked into it, but if I look at the graphs and you plot when COVID started in Europe, and then where COVID was on their graph when this started. So this was almost a month into it. So it was not a direct viral injury. So somebody who got COVID did not get it, but it was when they developed the antibody to that virus, that antibody was damaging to their immune system. So it was a dysfunction of their immune system, not the viral. So viral injury will cause something that you saw in adults, where they have severe pneumonia, they were in the ICU, they required ventilation. This was viral injury. Virus was replicating. This is an injury to their immune system after the virus occurred 1 month into it, when the antibodies developed.
So just to summarize that for some of you guys as well. So sort of, if we want to separate this from COVID or COVID-19, the virus, in that case, it was actually the virus that was causing the issues in the patients. From my understanding, there's a lot of theories with regards to this new immune-mediated illness in these kids. It's that their immune system is working so hard to fight off the virus that it actually causes some effects in their own body.
Exactly.
Hopefully that summarizes it.
Mm-hmm, mm-hmm.
Okay. And so, I mean, how are we treating this?
So basically, as I said, this is an immune-mediated illness. The children that are coming in, they are very sick. They are very sick because this immune reaction is affecting their cardiac health. I've never seen, like in Kawasaki's disease, you get cardiac involvement and coronary aneurysms, but you don't get your myocarditis, where your cardiac enzymes are elevated. I mean, this is the first time I've seen a troponin that's high in children. They have very high CRP, leukocytosis, and all that. It is any type of immune-mediated reaction would have a similar kind of treatment. Either it could be immunoglobulin supplement, like IVIG, intravenous immunoglobulin, or steroids. So they did both on these. Some people just got IVIG, some people just got steroids. They have tried on the children who went on to ECMO and got very, very sick. They did try the immunomodulators like IL-6 and IL-8 inhibitors, but very, very rare. Okay. Usually IVIG is the mainstream.
So these patients that are being treated. So I'll tie in a question that was asked from the audience about the fatality rate for babies and children, or individuals in general who are getting
most of the kids recovered. Most of the kids recovered. I think out of those 35 children, and the studies that are out are just 2. One was from Italy, which was published just 2 days ago in Lancet, and then there was another study from just Europe, and that had 35 kids. So 33 kids from this one, 35 from this one. Out of the UK study, only 2 kids died out of 33. All of them recovered from prompt treatment, and from the UK, from the Italy study, only one child died. And both the children that passed away, or all 3 of them, had some comorbidities already in them. The otherwise previously healthy kids that developed this did recover pretty good.
So by comorbidities, Dr. Bakhtyar.
Oh, sorry. I'm sorry. Yeah, comorbidities means they had asthma or seizure disorder or, any kind of underlying illness that they already had.
To touch a little bit more on this fatality rate, there was an article from the New York Times that just came out yesterday as well. So New York had 102 cases. Of the 102 cases, there was 3 deaths. I'm not sure what illnesses or underlying medical conditions may have been involved in those 3 deaths. But most of the people here are from Michigan. So Michigan has had about 14 cases. Most of them treated in the DMC or in Detroit Children's Hospital.
Yes.
I'm at U of M. No deaths that I've heard of. I don't know.
No deaths. No deaths. There has been only one pediatric death in Michigan in a child who had a neurological component to this virus. It was a direct viral injury because she was infected within a few days of her parents being infected. So it wasn't that immune-mediated illness, but she presented with seizures and intracranial pressure. We do not still understand what happened with that child.
That was very sad.
They're very unfortunate. Yeah.
Dr. Bakhtyar, before I go on to the question, is there anything else you'd like to add?
A lot of people right now are doing, a lot of physicians right now are doing telehealth. And when this virus started, a lot of people just looked at the data and said, okay, adults are getting infected, children are not getting infected. So people started to believe, non-physicians started to believe that children are somewhat immune to it. I just wanted to say here that children were always getting this. Children always had it. It was just we don't understand, for the reasons we don't understand yet, and we need more studies to see. Somehow the disease in children was milder. So people were kind of blowing it off. So people who are doing telehealth and looking at these children online, especially physicians, just make sure you ask the symptoms, the duration. Please examine carefully, or if you can't on video, just direct them to the right place where they can go. Sick contacts history is important. How long ago did the parent get sick? So that's very important if the child is presenting with fevers. So children are by far, by no means are immune to it. They're just showing milder forms of the illness, and they can progress to a very severe, deadly illness.
Because, unlike COVID, I read that none of these kids had respiratory symptoms, or like the cough, the congestion. Unlike COVID, I read that none of these kids had
there was
symptoms like
some of them did present, not in New York, but some of them did present with a milder amount of cough, and when they did their CAT scans and x-rays, they did found these ground glass opacities, but they were not the major disease causing stuff. Yeah, no. The main issue in these children was severe inflammation and cardiac and GI involvement. Okay. But severe inflammation with a very high CRP, very high white count, very high ferritin. Yeah, cardiac injury was the worst.
So there are a bunch of questions. I'm going to go to the live questions, and then I'll try to go to the people that left questions yesterday online.
So you have to tell me. So I'm gonna so how do I see these questions? You're gonna say the question to me?
Yes, that's okay.
Yeah.
There's questions about the first question I have is people worried about daycare and taking their kids to daycare. Should they not take their kids to daycare? What kind of advice?
It's a very legit concern. Okay, it's similar to what people are worried about reopening schools. It's very similar to that. There have been speculations that somehow these children are, so as I said, this virus is not very common in children. It can happen, but it's milder in children. Children are considered to be kind of like a dead-end host, where virus is going into them, but is not getting transmitted to everybody else. And that's why Denmark and everybody, they started opening their schools for under age 5. And they said these children will have it. They'll have a milder form of the illness. And then they won't give it to the adults, because that's what they noticed, that children are not transmitting it to adults, but adults are transmitting it to the children. So we don't even know if there was any point in closing these schools. They closed the schools so that children don't transmit it to adults. But they found that because of the receptor deficiency or whatever reason, this virus enters the child, causes a mild disease, and then just dies away. It doesn't get transmitted. So for daycares, I would say, once we've established a protocol of how are you going to screen these children, how are you going to screen the workers and screen and contact investigation and all that, if there's a safe method put in place to reopen daycares. I think I'm okay with that. The thing is that the daycares have been open throughout. The daycares have not been closed throughout this COVID illness. But the concern is legit. I mean, I can't tell you if it's right or wrong, but yeah, you have to be careful. Make sure that you send them to a daycare where they have clear policies of how they're handling mingling of children, you know, mingling of parents or caregivers. Yeah.
Are there, the next question is, are there any long-term effects to the virus or the immune-mediated response?
It's too early to say, Ali, because this virus has not been here long enough, you know? This virus just started. We don't have longitudinal studies to see what damage is it going to do to the person. It's whatever we've known from the adult data is that people who had more severe illness did have residual illness for a very long time. Just a span of 4 or 5 months, we've been dealing with this. In children, yes, in children. So coronary artery aneurysms were seen in children from this illness. Myocarditis. So myocarditis from a virus is recoverable. Coronary artery aneurysms about 80% of the time are also reversible, but you can have long-term illness to your heart from this. Yes.
And how do we counsel families with children in the household with parents or other household members who tested positive for COVID? What kind of advice would you give them?
So if a household member has tested positive,
yes,
and they're symptomatic or asymptomatic, I mean, they would only be tested if they're symptomatic, I guess now. If they're symptomatic and they're positive, they should quarantine themselves. Yes, they should, for 14 days or until the fever subsides. Yeah, 7 days.
Is there anything else that they need to be doing for
hand washing, making sure they're wearing a mask? Children under 2 should not be, but children over 2 should be wearing a mask around them. Just hand sanitization. Just, this virus is extremely sticky. Make sure that you clean surfaces with an antibacterial or with the Lysol, which kills all kinds of viruses. Yeah, and use hand sanitizer.
Okay.
Where are you, Ali?
I don't know.
Hold on.
There we go.
Yes.
What about breastfeeding mothers?
So the question is if mom has it and she wants to breastfeed?
Yes.
Yeah, this is a very good question. So we are allowing the mothers to breastfeed because we know that this virus does not pass through the breast milk. If the mom, we are teaching the mothers to do safe breastfeeding. So pumping is actually ideal. If they can pump, wash the container, wash their hands, and then give it to the baby, that's the ideal. But if they really want to breastfeed, AAP has a recommendation that they need to make sure that these moms are putting a mask on, and they are also washing their breast, they're washing their hands, wearing a clean gown, and then do breastfeeding on the baby. And then try to not to cough on the baby. But yeah, it's not the ideal. I prefer pumped breast milk, but they can do it.
Then another question was, how long after exposure do children typically show symptoms if they were to be infected?
So how long after the exposure to COVID-19 would they show this Kawasaki's like?
Yes.
Probably a month.
A month.
14 days to a month, because your antibody will start to develop after 14 days.
Okay.
So, and then the antibody is going to cause that immune-mediated reaction. So probably a month. Yeah.
Okay.
If I calculate it, yeah.
There's another question that was posted yesterday, and I've been hearing this a lot as well. If people are keeping their kids indoors and not going to school, is there a concern that the children will end up having weak immune systems?
No, not at all. Why would they have their immune system is already developed? What, they're not exposed? You mean to say that they're not exposed to all these viruses now, and then their antibodies are not being made?
Yes.
Depending on what age you're talking about. I mean, I'm not sure how to answer this, but depending on what age you're talking about. If you're talking about kids who have already had their share of disaster through school and their immune system is already completely mature, 6-7-year-olds, no, they wouldn't have. But yeah, maybe babies, if they're not exposed to any illness and they're put in a bubble, their immune system might suffer a little bit.
Okay, so kids over 6-7 that have been exposed to multiple viruses.
Their immune system's strong. It's fully mature. Yeah.
But
after 2 years, your immune system is pretty good.
Okay, well, you're the expert, so that's why. And then so there was another question. Do asthmatic kids need to take Pulmicort throughout the summer as like a prophylactic medication? I said most likely no, but maybe there's some.
Pulmicort is not going to prevent you from getting COVID-19. Pulmicort is given to children who have who have moderate persistent asthma. Moderate persistent asthmatics are at risk for developing COVID-19 infection, or asthmatics are more, well, the recent studies have shown that asthmatics are not at increased risk. But chronic lung disease patients are a little bit of a higher risk of developing a complication from COVID. So if you are prescribed Pulmicort through the summer, you should take it. But if you're in mild asthma, no, it wouldn't prevent you from getting it.
Next question, have you heard of any scar tissue development in these pediatric cases?
Were there any scar tissue development in adults?
I think it's still too early to see.
Exactly. I don't know. But the lung injury from this, lung injury from Kawasaki's like illness is not that bad. COVID-19 infections in children wasn't bad enough to cause severe lung damage.
And with the adults, the one with really severe lung damage, I mean, a lot of them will pass away, so you don't have.
Yeah, and children I've not heard. Speaking, if they have ground glass opacities like in RSV or I don't see a lung damage, but yeah, they're more prone to develop asthma and later on or something like that. But chronic lung scar tissue, no, I don't think so.
Okay, so there's just a couple more.
It's a virus that will heal from in children. Yeah, children are very resilient.
Oh.
There were two questions. Who is my favorite resident?
Oh yeah, who is
Reem and Wafa?
Yes, Reem and Wafa.
What do you think? It's the safe. I think my answer would be Ali for now. Yeah.
Okay, I'm happy. Wafa watching, so Wafa, you heard that. Make sure to pass on.
Wafa's watching. Wafa, I love you, but right now, Ali.
Thank you. Thank you for joining us in this chat. We're talking.
You're welcome. You're welcome.
He's in the chat. We're talking about life-threatening pediatric inflammatory syndrome. If you have anything to add, please don't hesitate. Dr. Rittering is watching now too. Bennett.
Hi, Bennett. How are you? How do you say? Oh, there he is. There he is. He's saying hi.
Make sure can you repeat what you just said so Bennett can hear? I don't think he heard it the first time.
Oh, Ali's my favorite resident. Everybody should hear this.
Off ascending Christ. Someone's asking, what advice do you have for someone that's starting a pediatric rotation? And
yeah, very good question. So we are actually dealing with this dilemma at our own hospital right now. We had closed the pediatrics floor because of the lack of PPE, and we were directing it to one center where PPE was available, because the rate of asymptomatic carriers in children and in adults, it's high. So someone who's starting a pediatric rotation, or anyone who's working on a pediatrics floor or any floor, anybody who, so we have now a policy that we will screen everyone who comes in and test everyone who comes in, so we know who's COVID positive and negative. But the testing technique can be every patient is a suspect. Wear your mask, if preferably an N95. If not, then at least double up your surgical mask. Careful about your hand hygiene. Anybody can be a carrier.
All right. Does anybody have any other questions they'd like?
I wanted to just say one more thing about this Kawasaki's like illness is that, Kawasaki's disease has been known for decades. It's an old disease. It's triggered by viruses. And it always comes in clusters. For some reason, it is a seasonal. Some people have speculated that it's Kawasaki's disease, not this. Could be seasonal, could be just virus, because a particular virus is causing it. So when that virus is high, this Kawasaki's disease will be high. So when we saw these clusters, we're not surprised. We always see Kawasaki's like this. If COVID-19 is just another virus that is causing it, just like EBV can cause it, or measles can cause it, or adeno can cause it. So it's not something unusual. We're not worried about it. Of course we're concerned, but we're not surprised, basically, as ID physicians. Yeah.
Okay, that makes sense. So I think just to tie this into general medicine with adults and pediatric cases, there is a concern amongst all providers that because of the scare for COVID, people are ignoring some health needs or symptoms that they're noticing, avoiding going to the doctor because they don't want to get COVID. infection. But I think one main point to take from this discussion is that if your child has a fever, you know, a lot of providers are doing the televisits, and then if
A
needed,
lot.
they can refer you to come into their clinic or to go to an urgent care or to an hospital. So if your kid is having the fever, you don't want to wait till day 3, day 4, till their immune system pushes them over the limit. You want to get them in early. You want them to seek treatment.
Just be in touch with your doctor. You know, doctors are risking their lives and they're working for your children. I just want to make sure that parents understand that doctors are also, or the workers, healthcare workers are also at risk for developing this virus, and they are as scared as you are. But we are doing this for your child. Just make sure that you do not ignore any of the basic, you know, pediatric healthcare needs of your child. So if they are sick, please contact your doctor. 90% of the doctors are now doing telehealth because they do not want to see these sick children in their office, but at least someone will be able to see them on video. Please do not miss out on their vaccines, the regular vaccines, because in the midst of this coronavirus, I do not want any other vaccine preventable disease to start its whatever game. Pneumococcus, or I don't want an outbreak of Haemophilus influenzae, or we don't want a varicella outbreak or measles outbreak again. So just make sure, please bring your children. Doctors' practices have started a very safe kind of practice. They're spacing out patients, they're wearing masks, they have plexiglasses. So we are keeping you safe and you keep us safe.
There's a couple other questions, Dr. Bakhtyar, so I feel bad not touching on them. One of them was, how can I make my toddler's immune system stronger aside from good hand hygiene?
Just eat healthy. Eat vitamin C and zinc have shown to increase your immune. It's an immune booster. You can do those. Just lots of oranges and stuff like that. Eat healthy, drink healthy, avoid processed sugars. Yeah, that's it.
How do you,
You know, there is a supplement that you can get over the counter. I think it's approved for children over 2, and I do recommend that to my patients because it's some evidence based. It's called immune boosters. They're called airborne. They're called airborne vitamins, airborne immune boosters. They're really good for children, and I do give it out to children during the RSV season, and it helps.
how do you respond to alternative therapy such as elderberry?
I have no training in alternative medicine. I'm sorry, I will not be able to help you, but I don't think that it helps or harms anything.
So we're gonna. So you touched a little bit about the poor outcomes in kids with, you know, other health conditions. Any outcomes of children with virus-induced asthma?
COVID-19 can cause virus-induced asthma, I think, like any other coronavirus. Coronaviruses have been out there for decades. Coronaviruses have triggered respiratory disorders, syndromes in children with asthma for decades. This is another coronavirus. It's a more deadly one, more highly contagious one. But it will cause asthma in children, trigger asthma in children.
I want to respect your time. It doesn't seem
I'm
like,
enjoying it. I have time. Yeah, very much.
Is there anything else you'd like to add?
I love it.
All right, guys, give her some more questions. Dr. There's a question.
Although my husband might be hating it at home. He's like, where are you?
Let's see, there's a question right here. Let's see.
I think the questions that you posted before, I don't know if I touched on every one of those. Did I? How different it is from Kawasaki's. There was someone who asked me, and that was a very good question, because they did do a study where they compared Kawasaki's disease with this, and that's when they came to a conclusion that it is a distinct illness in its own self, and it's not exactly like Kawasaki's. They saw that the ages of the children were different, and I actually wrote it down somewhere, and if I could pull that up. So platelets are not as high. CRP is higher in this disease than Kawasaki's disease. Fever is higher in this disease than Kawasaki's disease. So it is it is similar presentation, but distinct features are different. Troponins are never high in Kawasaki's. Ferritin is not that high in Kawasaki's. D-dimer is not that high in Kawasaki's. This one is causing it.
What portion of these kids are needing ECMO?
I would say about maybe 1%. if I take the percentage out. Yeah.
1%.
Every population that we looked at, about 1 to 1.5% children required ECMO.
And you brought up the fact that there was 15 cases on one day. Was there a close proximity with
Yeah,
these kids?
that was strange. They were blown at Children's Hospital. 10 cases. 10 cases in one night. All came at once. I'm thinking if there was like a community and they were all African American kids, there was a community where a lot of adults got infected at the same time, infected their children at the same time, and they all just kind of built their antibodies within that time frame, and they all had that surge. There were no Caucasian children, actually. This was something very surprising. I think the more stronger, as you said, the immune system is, the more severe the reaction is. And healthy, robust, immunocompetent, healthy African American children, and I think in adults too, you saw that. A lot of healthy, robust, athletic, buff African American guys were the ones that were the sickest. The more strong your immune system is, the more severe the immune-mediated cytokine storm is. That's why the people who had HIV, if you notice, if you look at the data for HIV and all these, immunocompromised people, dialysis patients, they did get it, but they weren't that, they all recovered. Not all, but most.
Most, okay. As long as they weren't older in age.
Yeah. I'm just putting into perspective that why younger, healthier people got infected more.
Thank you. We appreciate that. I'm done with my questions.
Okay, very good. I loved having you guys here, whoever was there. And then Ali, thank you for giving me the opportunity. I enjoyed it a lot.
Maybe we can do this again if anybody
Yeah.
interested in learning about any other topics, pediatric topics. We can do this for sure. Someone's gonna say talk about vaccine.
I will talk about vaccines. I love talking about vaccines. I can go on and on. But I just want to say here that, I work for Beaumont. So if you want, if you would like, I accept patients. I accept new patients. So if you have any, children that you want to be seen.
Yeah, Dr. Bakhtyar is an amazing physician. She currently works in Beaumont Hospital in Dearborn, is around there.
Bafa, yes, you are my favorite. I give up now. The session is ending.
Wow. Okay. I was basically promoting your practice. Well, she has a
Go ahead.
As well. Amazing physician, takes her time with her patients. I would highly recommend anyone in the area or anyone around Metro Detroit to visit their practice. You can just go online, search Beaumont Pediatrics Canton, and you can call the clinic and make a meeting with.
So people are asking me for my info. I don't know if you can put up my business card or something out there somehow. I'll send you a picture.
I'm going to put the business card on my story for anyone interested. Okay?
Thank you, Ali.
Thank you guys.
Thank you. Bye. You too.